What are enamel defects? Enamel defects can be qualitative. The qualitative ones are known as hypoplasia. The enamel defects can be quantitative. The quantitative ones are known as hypomineralized. Hypomineralized can be further divided into hypomatured and hypocalcified or the combination of both. Hypoplasia. Hypoplasia means the enamel is hard with a normal or slightly yellow brown color. Frequent microfractures of the enamel and possible adhesion. It can be autosomal dominant, recessive, and X-linked. It have normal or reduced enamel thickness throughout the whole surface or in isolated areas. There are enamel pits, grooves, fissures, and linear depressions randomly distributed over the entire enamel surface. Hypomatured enamel. In hypomatured enamel have adequate deposition, but the enamel crystal does not mature normally. The result is soft, pigmented enamel that chips easily. There is opaque mottled enamel of normal thickness. Enamel approaches the radiodensity of dentine. There is relatively soft enamel with frequent microfractures. The enamel is mottled with brownish yellow to white appearance. It can be autosomal recessive, autosomal dominant, or X-linked. Hypocalcified enamel. In hypocalcified enamel, there is inadequate mineralization. The result is enamel that gets lost a few years after eruption. Regular enamel thickness at the time of tooth eruption. The soft enamel is easily removed. There is gradual reduction of the thickness resulting from easy adhesion. The only dentine remains in severe forms of defect. There is increased sensitivity in thermal stimuli. Yellow brownish color of the enamel with pigment deposition. It is associated with anterior skeletal open bite. It can be autosomal recessive or dominant. Combination of hypocalcified and hypomatured enamel. In hypomature hypoplastic pattern, the primary defect is enamel hypomaturation. There is mottled yellow-white to yellow-brown enamel. While in hypoplastic hypomaturation pattern, the primary defect is enamel hypoplasia. It means there is thin enamel. It is mostly autosomal dominant.